So thank you everyone for joining us today for our Genomics in Medicine and Health Strategic Planning Workshop. We really appreciate all of you coming for these 2 days to be able to talk to us about how we can find ways to be able to improve genomic medicine and really come up with solutions for implementation going forward for the future. So you might note that our agenda for the next 2 days is a little bit different than maybe some other workshops that you've been to recently. So rather than focusing on having everyone listening to a lot of talks, we are going to definitely have a number of presentations over the next 2 days. But we really want everyone to be focusing on the discussion and interaction with these presentations. In order to be able to highlight this, we've set up this meeting a little bit differently. So some of you are here because you submitted ideas to our online submission a couple of months back. We went through and received 80 submissions from ideas in the community and selected a number of them then to have attendees come to this meeting and be able to present your ideas in this forum. We're also going to be having a lot of discussion throughout the meeting. You'll notice that for each of the 6 themes that we're going to be discussing, there's going to be a series of short presentations and then 40 minutes set aside to be able to have broader discussion throughout the group. For each of those themes, what we're going to ask everyone to do is to come up with your row. Most of you are seated in rows with the rest of your theme. We have a chair for the moderator and all of our speakers on the side, and then we'll be able to have people just pass off the microphone and the clicker as you go through your presentation so that we can try and make sure that this runs quickly and smoothly. For everyone who's giving one of those 5-minute talks and needs to be able to know what their time is, we do have a timer set up here at the front of the room so that you can see it counting down from 5 minutes. When you get to 5 minutes, it is going to flash bright red. Please take that as a warning, because if you go much longer than that, we're going to come and find you. We need to be able to stay on time just to be able to respect the fact that we do have a number of presentations that we're trying to get through over the next 2 days, and we want to make sure that everyone gets a chance to share their ideas. Another aspect of the meeting that might be a little bit new is the interactives that we're going to be doing throughout the 2 days. We're going to start off with one of them here this morning. For everyone who's here in the room, we're going to be asking you to get online. The Wi-Fi in the room is through the NIH Guest Network. You can do this on your laptop or your phone, and we will be putting up on the screen a website that you can access to be able to get to the interactive events. For those interactives, there's then going to be a series of questions that you can answer online, and we are actually going to then try and show you the results pretty close to live here at the meeting. So we're going to have people fill out the results. We're going to have a couple of talks this morning, and then we're going to pull up those results and share them with you. So just to start us off today, we wanted to be able to have introductions from everyone here in the room. We're trying to keep this pretty short because we do have a lot of people here and we want to be able to have more time for discussion. So we're asking everyone to give us just your name and 2 words to be able to describe how you see your role fitting with genomic medicine. So for example, you could give your name and that you're a genetic counselor, or your name and that you're a clinical researcher. So we're just asking for a couple of words to be able to describe how you see yourself fitting into this genomic medicine enterprise. And for those who are on the side, we're going to have a mic that you can pass along to be able to do your introductions as well. This will also serve as a test of learning how to be able to use the microphones that are on your table, which is how you're going to be able to speak and give your questions throughout the day. And then on here, I do also have the email address, which you're going to be seeing throughout the meeting, which is where anyone who's listening into the live stream can submit their comments and questions, and we will have those read out throughout the meeting discussion sessions as well. And so I think we can then start off with introductions. So I am Anastasia Wise, and I am a program director.
My name is Jyoti Dayal. I'm also a program director for Division of Genomic Medicine.
Les Biesecker, intramural research.
Terry Manolio, physician epidemiologist.
Carolyn Hutter, Genomic Sciences.
Alex Raphael, program analyst.
Taylor Lynn Steffen, program analyst.
Natasha Bonham, health advocate.
Mike Murray, genomics physician. Denise Dillard, Director of Research for a tribal health organization.
Latrice Landry, molecular geneticist and molecular epidemiologist.
David Adams, clinical genetics and researcher in the intramural program.
Heidi Ream, clinical genomicist.
Mulai Murugan, technology and software.
Michelle Clark, statistical scientist.
Alicia Joe, genomic scientist.
Tony Winchow-Boris, physician scientist.
Jillian Hooker, genetic counselor.
Juan Rodriguez, bioinformatics science.
Katrina Goddard, genetic epidemiologist.
Hi, Iftikhar Kulu, clinician investigator, translational genomics.
Lisa Bastrash, data scientist.
Erin Ramos, program director.
Rob Rowley, a program director.
Sula Hood, public health translation.
Patty Spears, patient advocate.
Carol Horowitz, primary care doc and health equity researcher.
Aniwa Owusu-Beng, clinical pharmacogenomicist.
Bob Wilden, clinical and laboratory geneticist.
I'm testing out the mic. I'm Carolyn Menendez. I'm the chairman of cancer genetics at Duke.
Sarah Bates, communications.
Oh, go ahead.
Colleen Kalishu, genetic counselor and investigator.
Andrew Dwyer, nurse scientist.
Jennifer Surtees, biomedical researcher and community-based researcher.
Heather Colley, program director.
Donna Messersmith, NHGRI, provider genomics education.
I'm Dustin Baldridge, genomics investigator.
Shumita Dashgupta, medical genetics educator.
Dan Rakonda, genetic counselor and program director.
Pam Wilson, program manager, Personalized Medicine Institute.
Daniel Schreiner, genetic epidemiologist.
Wendy Chung, medical geneticist.
Lucia Hindorf, program director.
Mira Irons, pediatrician and medical geneticist.
Meg Dorr, genetic counselor and researcher.
Chris Gunter, senior advisor.
Jeff Ginsberg, genomic medicine strategist.
Dan Roden, like Jeff Ginsberg.
Gail Jarvik, physician scientist.
Mark Williams, implementation scientist.
Chitari Shivakumar, scientific review officer.
Method Baknamo, SRO, genomic study sections.
Adam Felsenfeld, program director.
Mukul Neriker, web editor.
Alvaro Encinas from NHGRI webcasting team.
Great. So we actually made it through all of those in time. Thank you everyone for keeping your introductions short. So now what we're going to do is turn to the first of our interactives. So for this interactive, we're going to be asking everyone to fill out a response to 2 questions. The first of these will be asking, what do you think the #1 barrier is to implementation of genomic medicine in routine clinical practice? And the second will be asking, what do you think the #1 opportunity is for implementation of genomic medicine in routine medical practice? So for this activity, you can go to genome.gov/video/genome-TV-live. For those of you who are watching the live stream, the links will be located right below the video on that same webpage, and you're looking for barriers and opportunities #1. Once you go to that link, it's going to bring you to Qualtrics, and you should be able to see the 2 questions. You can do this both on your computer or on your phone. It is mobile friendly, so you should be able to access the link either way. And if anyone has any problems, please let us know. We can help you with trying to be able to access, as well as we do have an extra tablet available. So if anyone really does have a problem being able to get in on their device, we can make sure that you can fill out those 2 questions as well. So we're going to give everyone 15, 20 minutes to be able to fill out these questions, and then we'll come back and look at the results after we go through some of our introductory presentations. So thank you everyone for joining us, and we're looking forward to hearing your thoughts on barriers and opportunities. We'll leave the link up in case anyone has any questions.